Recently, a viewer had asked a question, my baby's umbilicus is swollen. Is it normal? Let us see the answer in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week your health related queries are answered via short videos. If you want to see such videos, subscribe to this channel. Also, if you have any such queries, kindly post it in the comment section. I will try to answer them in subsequent videos. Today's video is about babies having their umbilicus swollen. What is this due to? This is commonly due to umbilical hernia. Hernia means there is a defect in the abdominal wall and the intra-abdominal contents. That is what is inside the abdomen. Usually the bowels are there. These come out through those defects. So umbilical hernia means there is a defect in the abdominal wall at the region of umbilicus. Because these tissues are very scarce, it is a very thin tissue at the umbilicus, and through the umbilicus, when the baby is inside the uterus, you had umbilical vessels coming in and going out. Once the umbilical cord is cut, this layer of abdominal wall there is very thin, so you might have an umbilical hernia. Majority, that is up to 90 to 95% of these umbilical hernias close spontaneously, even if left unattended. So you need not worry, you need not do anything about this. Possibly in less than 5% of cases, what can happen is this defect can be a large defect. If it is a large defect and doesn't close by the age of 2 to 3 years, then probably a surgical intervention and closing of this abdominal wall defect may be required. Very rarely, as a complication in umbilical hernias, you might sometimes have bowel contents becoming incarcerated and sometimes strangulated, meaning their blood supply being lost. This can be a surgical emergency. How to identify this? In a child with umbilical hernia, if you have abdominal pain, vomiting, the swelling region becomes red or black in color, the child has fever, all this developing in a child with umbilical hernia, probably you need to visit the doctor urgently. But in majority of children, 95% of the children, umbilical hernia closes spontaneously. You need not do anything, you just have to wait for it. What about folk remedies or household remedies where they tie coins or something on the abdomen just to close the defect? No, there have been many scientific studies that this is not required, this is not helping, this might sometimes be problematic. So these things need not be done. You just leave the umbilical swelling, it will heal on its own, it will close on its own as the child grows older. Hopefully this would have answered your query on swelling of the umbilicus. If you want to see such videos, consider subscribing to this channel. Till we meet again, bye.